But in the meantime, you've all seen, if you're connected by video anyway, uh, Dr. Mark Levine on line with us. We're real fortunate to have him. This is, by my count, installment number 18 of these Monday afternoon meetings that we've been having on a different subject matter each week, with a lot of different expertise coming our way and everything. But this is the first time we've really gotten into the whole medical perspective and angle, being financial institutions more focused on the economy and compliance and things like that. So we're real fortunate to have Dr. Levine with us. Obviously he's got a very busy schedule, but he's at the heart of all of this effort in Vermont by the administration. And so we just figured that we'd impose on Mark to give us his insights on, where, from his perspective, where he sits, where does he see things at right now, and what are the big issues facing us as a state going forward, and what's it maybe, if you have a crystal ball like we always ask economists to do, what do you see coming up in the fall or winter or somewhere down the road? So with that, and I encourage people to ask questions along the way or at the end, but Commissioner Levine, why don't we just turn it over to you and let you share your wisdom.
Yeah, thank you, and thanks for inviting me. I'll try to cram a lot in a short time and allow some time for questions as well. Let's look at where we've come from. First case in Vermont, March 7th. First death, March 19th. The peak of our cases occurred in the first week of April. And here we are now, late in July. Certainly, our 1,350 cases pale in comparison to many states that are in the double and triple digits for numbers of cases. But this is where we are. And since that peak in early April, we've really had a lot of vacillation and oscillation around a baseline without really getting too many extremes. We had one outbreak in Winooski and Burlington that did have over 100 people in it, but other than that, it's been very low numbers. Our new normal, as I call it, is isolated cases, occasional clusters, often in households, and then occasional outbreaks like the Winooski one. We were just recognized and continue to be recognized this week because people are always looking for good news, and that we've gone over a month without a death. So our deaths are at 56, and that's really testimony to a lot of good work, which I'll get into. Think about the fact that we went from our old normal to within a 1 week period, essentially shutting down everything in Vermont. And then by the end of the second week, we had Governor Scott's stay home, stay safe order, where we were clearly hunkered down, not only shut down. And now we're in that phase continuing of reopening and what we call restarting Vermont. And it has been very phased and graduated. And not only that, it's really a sector by sector analysis. So it involves, looking independently at lodging, independently looking at retail, independently looking at the healthcare sector, the education sector now, bars and restaurants, you name it. Beyond those so-called essential services, which I believe you folk all play a big role in part of them, there's so many opportunities for how do we correctly reopen ourselves up. And the fact is, we've really done this in a very phased way. Our principles have been simplified guidance, meaning everybody in Vermont should know 4 things, and that's stay home if you're sick, wash your hands a lot, physically distance 6 feet or more from people, and wear a facial covering. We've had a principle of the 3 C's of contact, which are basically avoiding close contact one-to-one, but you can get your hair done, but not for hours at a time. Avoid a significant contact density, like being indoors in a crowded space, and avoid the duration of contact that might be close. So, 15 minutes or less, but don't go too crazy if you're in close contact with people, especially if they're not what we would call a trusted household, where you actually want to have them over, sit on your deck, physically distanced, but be in their company for a couple hours at a time. What are the lessons that we've learned along the way as we've encountered this virus? I'd say, first of all, the fact that in somewhere between 20 and 50%, asymptomatic spread is what's occurring. So that's the most dangerous part of this coronavirus is you don't actually know that you're sick and can give it to someone else, or that you're talking to someone who's going to give it to you, who both of you are feeling well at the time. And it's about a 48-hour period where that can occur. So you have to be very careful and abide by all of the principles that I just mentioned. And that validates those principles, essentially. We've learned that if you're a country like the US that is not prepared with a stockpile of PPE, is not prepared to do testing on a mass basis, doesn't have a pandemic plan in place, you are not going to be able to contain this virus. You are going to have to go straight to what we call these mitigation strategies, which are these interventions like all the ones I mentioned. Closing things down, staying at home. That's all you have to do. You don't have any other choice. But the preferred strategy with any infectious condition is containment. To do containment well, you need to be able to figure out who has the condition, which means you have to be able to test for it. You then have to be able to find those people and isolate them. Then you need to talk with those people and contact trace, find out who they've been in contact with over a critical time period. And then finally, you need to have the people that were at high risk because they were in contact with the case, you have to have them quarantined. Very simple. It's called a box it in or containment strategy. And we're actually doing it now every day. And it's actually working. And the fact is, once we got through that traumatic time of mitigation and getting the virus, if you will, suppressed to a low level, we're able to now face an outbreak like Winooski, face outbreaks in childcares and camps and work sites, you name it. We've encountered them all, and use this kind of a strategy to keep them tamped down and not have community transmission of virus occurring. So that's really the key, is to making sure that we don't get to a point where there's community transmission of virus. And having this concept of testing well available and being able to target it strategically is really the key. So not everybody needs a test every day of the week, but there are times people need a test because they are a contact or because they're in the area that is of concern. Other times people need, because of the nature of their work, to be tested because they deal with vulnerable populations or they themselves are a vulnerable population. But you need to be able to have the capacity so you can strategically target it. So we are now in that phase where we as a state suppressed the virus so well, due in no short measure to the cooperation of everyone who lives here, that we can enjoy the benefits of a containment strategy. What could disrupt that? Well, people always talk about opening the borders being a dangerous thing. We've got rules in place so that people can come from areas like Vermont and just go on vacation here. But we also have rules in place that if a Vermonter traveled to Florida or elsewhere, or if a traveler wanted to come to Vermont from a high intensity place, they have to quarantine. And we'll try to make that easier for them with a 7-day ticket, so to speak, to testing. but they need to abide by that. And if they don't, we could run into trouble. Likewise, if we reopened some of these sectors that I talked about too rapidly, or allowed people to get too close, if you will, because we put them indoors in a restaurant where there was no spacing requirements, no masking requirements, we would pay the penalty. And I think what we're witnessing around the country now is just that process playing out. A lot of states that opened much too quickly on a very accelerated scale, some of them at a time when the disease suppression hadn't even happened yet, so they weren't quite there. So they already had enough virus going on, it was only going to get worse. And then human nature, Memorial Day, 4th of July, times that actually people said, you know, I'm ready for normal again, and let their guard down, and this is what happens. So that's what we're seeing around the country. Other lessons we've learned, the importance of stockpiling. We are trying to stockpile like crazy our PPE and some of our testing supplies, because we don't want to be in a position anymore where we are vulnerable to losing those at a time when we need them the most. Can we do that effectively? Yes and no. We can do that effectively for now, but if something really big happened later, I'm not sure any state could have accumulated as much as they need, because there is still supply line deficits in all of those areas. And unfortunately, and I'm not making a political statement, this country has no coherent strategy for dealing with the virus, and no coherent strategy for making sure that all of its citizens are safe, meaning the healthcare sector has PPE, meaning if you need a test, you can get a test when you need it. We have governors competing with each other for all of these kinds of supply chains, which is really ludicrous. And not only are they competing with each other, they're competing with the prime ministers of other countries for the same things. That's not the way to run a response to a pandemic. Other lessons we learned are how to protect the most vulnerable. So one of the core reasons why our deaths stopped at 56, and believe me, they will increase again sometime, but that we haven't had one for a while, is we really have very strong policies in place at our nursing homes for protecting the nursing home from not only staff members who might bring the virus in unwittingly, but from visitors bringing it in, or even more importantly, from a new admission bringing it in. Because a new admission has been in contact with hospitals and the outside world. And unless they are put under a rigorous testing protocol and a quarantine protocol when they arrive, the nursing home is vulnerable. And we've been able to implement both of those at those sites. Other vulnerable populations, of course, include the corrections operations, which we've got a lot of testing protocols in place there as well. And we hope as colleges come back, similar protocols are going to help the reopening of the colleges, with all the students coming to Vermont from all over the place. Another lesson we've learned is we really can contain outbreaks, as I've mentioned. And I think an important lesson is how a population responds to being given the straight facts, and how just that process alone enlists their cooperation and allows them to understand how important their cooperation is, and every citizen's cooperation is, to the greater good and to being able to live as normal a life as we can in these days and times. In terms of the future, that's an incredible question. Because, you know, I don't want to get us so pumped up and optimistic that we think, you know, Thanksgiving is going to be different than we imagined, but I also don't want us to despair. So I have to be somewhere in between. There are more viral therapeutics being developed. Most of those, unfortunately, are if you're really sick and needed to be hospitalized. or God forbid, on a ventilator. But there are better things happening for people in those settings. It would be nice if we had something for the majority of people who actually don't have to be in a hospital, but who we don't want to get so sick while they're an outpatient that they end up in the hospital. Then the big question is also, will there be a vaccine? And though the enthusiasm nationally is getting a little out of control, the bottom line is these vaccine trials are moving faster than ever. The vaccine candidates, as they're called, that have been most talked about, when they are given to humans, actually cause the humans to form antibodies against the coronavirus. So that's a wonderful thing. The question is, now when they go into longer phase trials, will they actually be protective in the human being against the coronavirus? It's one thing to show there's an antibody, it's another thing to show if the antibody does anything. So we will find that out, and we will also find out how safe these vaccines might be. Because it's one thing to have an effective vaccine, but if it has a side effect that affects too many people, probably not going to be something that goes to market. But the trials are moving so fast that some people are talking about by the end of the year knowing which vaccine is going to fly and trying to manufacture enough of it on a large scale that you can begin serving big populations. One thing we know is that the vaccine that ends up being chosen, or the vaccines, because it'll probably be more than one, we'll still have a priority scheme for who gets it first, who gets it later. And of course, the priority scheme will have to prioritize those in the healthcare sector, but it will also have to prioritize the most vulnerable among us who could suffer the most when they get the virus. So just to think about deploying it on a mass population basis could be very, very challenging. The last couple of things I'll say about the future, maintaining our readiness with regard to testing, with regard to PPE, with regard to contact tracing capacity, all of that we think about every day now, because you have to plan for the worst and hope you just never get there. And then this whole notion of how much we've opened thus far, can we open further? You know, we get retail to 50%. Can we go to 100%? We get lodging to 50%. Can we go to 75%, to 100%? We go to outdoor dining, then we go to indoor dining, but like, 25%. Can we go higher? All of these sort of pushing the envelope questions have to be supported by data. And they usually take a couple weeks at a time to figure out, because the incubation period of the virus is anywhere from 2 to 14 days. So it really causes us to have to be a little patient as we move along, knowing that we can't go so fast that we end up like some of the states that you're watching on the news every night, because that's the last thing we want in Vermont. And so one of the other messages we're trying to do now is sort of risk levels. And I like to think about them as continuum. If you like to exercise, well, if you want the lowest risk, you're going to go take a walk by yourself in the woods. Maybe you'll get on a bike because you can be biking without being around a lot of people. If you want a more intermediate risk, maybe you'll play golf with a bunch of trusted friends. If you want a higher risk, you'll play a contact sport like basketball or football, or be a spectator in one of those sports, either way. If you like to eat, as we all should, the lowest risk would be making your own meals or driving out somewhere to take takeout home. Something more intermediate would be eating outdoors at a favorite place. Something more risky would be an indoor dining experience. And you can sort of cover that for any sector you want. Transportation, driving your car versus driving in a taxi versus flying or taking mass transit. You carry it to any level you want, and just begin to think about your own exposure budget, as I call it. You don't want to overexpose yourself in too many ways, and you want to be very deliberate about the decisions you make. knowing that one decision is all it might take to encounter the virus and have to deal with it as you may. So I think that leaves us with almost 10 minutes for questions. And so I will sort of stop there. I tried to do as comprehensive but roundabout talk as I could in a limited time. So let me, I guess I'll let you, Joe, moderate or whatever.
Thank you so much, Mark. Any questions or comments from anybody? So while people are thinking or getting brave, I'll start off. You mentioned about the vaccine situation, and as a matter of fact, I noticed something in the news today that somebody, I don't know if it was MSN or someplace else, was touting the development of a vaccine, potential vaccine in England, I think it was, that had been already tried amongst 1,000 people or something like that. And, of course, it's a headline grabbing kind of thing, right? But even, with something like that, that is, if it were successful today even, I've just always assumed, and I have nothing to base this on, that, it's a long road, a long uphill road through to get to the point of mass production and distribution and all that kind of stuff. So, getting back to reality, this weekend, I find myself in a restaurant in downtown Burlington outdoors. They did a good job with the social distancing and all that kind of stuff and the disposable menus and so on and so forth. But I'm sitting there thinking, what is this going to be like when it's too cold to be sitting outdoors? And that's just a restaurant, which coincides, by the way, in Vermont with the beginning of flu season. So, how do you think things look like when we don't have the option of riding the bicycle, like you said, or sitting at a table 6 feet away from somebody else outdoors, and so on and so forth, and everything moves back indoors? Does that heighten the risk, the potential risk of contraction and the infection rate in the state?
Absolutely. Except if we've been able to continue this suppression strategy where we don't have that much virus circulating, in which case it will lower everybody's risk if we could keep that going. However, we do see things coming up the coast, so we're sort of watching that very closely to make sure the Northeast can remain as good as it's been doing. I think as the weather changes, that's when viruses thrive, because humans are together more and they can pass it along. But remember, the facial covering, masking, is really being shown more and more now to be effective. And it's a shame that it hasn't caught on to the degree we would have liked, and that the CDC originally said, forget about it. Now it says do it, giving mixed messaging, but it's really quite effective. So as long as we can have these cultural transformations about the way we behave, we might be able to do more of the kinds of things you're talking about. The other part of that, though, is we are very cognizant of the convergence of flu season and coronavirus at the same time. And so we're really doing a major push for having people get vaccinated for flu early as possible, and for making sure we get as many as possible. Now it's more important than ever. At least prevent something you can prevent to the best degree possible.
Thank you. Anybody else?
I had a question, if I could, Joe.
Great, Doug.
Dr. Levine, Doug Fisher from Vermont Federal. First of all, thank you to you and the governor and your whole team for all your efforts through this. I think you've done a wonderful job in controlling this, and kudos to you all. Thank you. But you were talking earlier about the distancing, and you mentioned, staying 6 feet and limiting contact to 15 minutes if you have to have it. And then you mentioned something about a 48-hour period. I'm not sure what you were referring to there. If you could.
That's called the pre-symptomatic period. So you can go as many as 48 hours when you're able to infect someone, but you don't know you're sick yet because you haven't come down with symptoms. But that's the the basis for all the things we tell people to do and not to do, knowing that there's that 48-hour period for anyone to potentially transmit the virus to someone else unwittingly. So that's what that was all about.
Okay, thank you. So if someone is asymptomatic throughout, they're still contagious though, correct?
That's a good question. So it's not clear that you're contagious all the time when you're asymptomatic. However, the fact that so many people get this virus so easily makes us believe that there must be some element of transmission going on from asymptomatic people, possibly longer than the 48 hours. But what we're more confident of is the 48 hours.
Great, thank you.
So is the 48 hours the whole part of the basis on the tracing, that when you find out that someone's infected, you have to look back who their contacts were over the past 48 hours, or do you go further than that?
Yeah, so the 48 hours is the most critical, but now we're actually going back 14 days just because we want to try to figure out all the possibilities about how a person themselves may have gotten the virus. And if we don't go back 14 days, you might not know, since it could take 14 days for them to develop symptoms. The majority of people are going to develop symptoms in that 4 to 7 day period, but there's a few percent that go as far as 14.
There are so many conflicting headlines in the news and everything these days. And one of them, for something you said, reminded me of seeing conflicting headlines over the past week about children, that earlier on children, they don't, share it with anybody else. And then more recently it was, oh, yes, they do. And so do you have any insights on that?
Yeah, so, we've done a lot of work in this and a lot of research in this. People are worried about opening schools and child cares and
Right.
all of that. And they should be. I mean, it's a natural thing. However, most of the instances where children get ill seem to be because the adult brought the disease in, whether it's to the school, whether it's to the family. The child was not usually the index case, it was the adult. Now, there are studies in Europe that look at a kid in class who had the opportunity to infect 80 other kids, and none of them ever became symptomatic or tested positive. So it's not thought that the child-to-child transmission is the big problem. It's the adult-to-child that introduces it into the classroom or childcare or whatever. The second part of that, though, which a recent Korean study helped flesh out, is that in the 0 to 9 age range, everything I just said is mostly true. In the teenage range, that's where they begin to act a little more like adults when it comes to how they react to the virus. So people are a little more nervous about the middle and high schools than the K through 6. And that it's just because of the way the virus seems to behave in older children, if we could call it, versus younger children.
Sure. And last question for me, also in the news this weekend was first it was reported outbreak, and then it was it's a false positive in Manchester area, was it? Manchester, Vermont?
Yes.
So what, do you have insights as to what happened in that case?
We're accumulating insight, but we don't have the final word. All we know is there are lots of positive tests from the antigen test that aren't confirmed by the PCR test, that is the traditional test. Only 2 out of 35 people that had a positive antigen test had a positive PCR. And many of the people who had the antigen test done in the first place were not having symptoms or had symptoms that weren't classic for COVID. So it's a little unclear if that plays a role as well. Right now, it's unclear if it's a problem with the antigen test, the PCR test, the way the test was deployed in the population. some error in the analysis steps with the laboratory, some contamination. Everything's on the table, and we just don't have the answer yet.
Got it.
But we have felt pretty comfortable that based on mass testing done, pop-up sites in that whole region, there's almost no virus that we detected. So there's not community transmission occurring that we can detect.
This is,
Sorry, go ahead, please.
that's okay. This is Susan Church from New England Federal Credit Union. And I had a question with regard to what will be the time frame and the deciding factors that you and the governor will look at in determining whether the schools will be able to reopen? And when do you think that decision will be made or changed, I should say?
Yeah, right. The decision's already been made. So it would only be changed, and that would only mean that suddenly all of the virus that we're fearing is coming to Vermont arrived to the Northeast, and it was bringing us back to situations like we had in March.
Okay.
I don't foresee that being an issue at all. But that's what we watch, is all of the sort of guardrails, as Commissioner Pichak calls them, that we're watching for every sector that we open would be the same for the child schools as well.
Thank you.
Any parting comment or question from anybody before we let the commissioner go? You've noticed, Mark, sometimes I refer to you as commissioner, sometimes doctor, because I don't know which is appropriate, and it feels weird to say Commissioner Dr. Levine.
Well, all are good.
Thank you so much for joining us this afternoon. We really appreciate it. We know you're on a very, very tight schedule and pulled in a lot of different directions. And again, you're doing a lot different job than was probably expected when you first accepted your commissioner appointment. But as Doug Fisher said, and I want to echo, we all thank you for the great work that you're doing and that the administration is doing to keep our numbers in Vermont as low as they are. So thank you very much.
Yeah, and thank you all for listening. I've enjoyed talking with you. Bye-bye.
Thank you. Bye. I have just 3 small announcements for everyone, and that's that reminders more than anything else. Tomorrow, the U.S. Senate Banking Committee in D.C., or I suppose they're doing this virtually, at 10 a.m. is going to be having a hearing where they're going to be interviewing the new NCUA board nominee, Kyle, I'm not sure how to pronounce his last name, Hopta or something, Hopma. He hails from the state of Maine. We've written about him before. It's online if you're so inclined to watch that hearing. A week from today at 2 o'clock, Steve Rick, CUNA Mutual's chief economist, who we've had in one of these meetings before, is doing a presentation for members of CUNA councils about, his updated economic outlook. And I don't know if, like me, you've participated or seen a number of these different economic presentations, but they change by the week easily, sometimes by the day. So if you haven't seen him before, he's very good in this presentation. And again, that's a week from today at 2 o'clock. If you're a member of a CUNA council, you should have gotten an announcement of that. If you haven't, but you want to become a member and see that, send John or me an email and we'll give you some information about it. Lastly, it's a little bit early announcement. John Cody is going to send me a mental slings and arrows as I tell you that our annual meeting, you're going to see an announcement coming out from us shortly. Remember, our annual meeting was scheduled for May. Obviously, I had to postpone it to September. We had it on September 17th scheduled at Jay Peak. Have to postpone that as well. So we're moving to a virtual format. We haven't finalized the date. It will be late September, early October. It will be virtual during a weekday, probably occupy a span of a few hours. We'll have a business meeting plus a couple speakers. I think you'll enjoy it. And so watch for news of that coming out in the next news lines or one of the next couple news lines. Have I got all that right, John? Anything I'm omitting that we ought to be mentioning at this point in time?
We have a tentative date, but we can't announce it yet because we haven't lined up any speakers for it. So,
Right.
so that's going to be happening hopefully this week, and we'll get the information out as soon as possible. I'm hoping to have it out in Newslines Express this week, but if not, certainly by next week.
Awesome. Thank you, everybody. Anybody have anything that you want to share with anybody else, or any suggestions for future presentations that we do on these Monday afternoon Zoom calls? Please feel free to share now or send me an email. We certainly are open to any ideas, and some of these came from some suggestions from some of you. So thank you very much for doing that. Again, thank you very much for joining us this afternoon, and thanks again to Dr. Commissioner Levine. He really bent over backwards to try to squeeze us in here, so we greatly appreciate it. Anything else from anybody? All right. Well, then, thank you very much, and I hope you have an awesome week.